Hello, my name is Crystal Bryant, and I am an RN to BSN nursing student. And today I'm going to perform a head-to-toe assessment on my patient. First thing I'm going to do is wash my hands, introduce myself to my patient, and ask for permission to do a head-to-toe assessment. Okay. My name is Crystal, and I'm here to do a head-to-toe assessment. Would that be okay with you?
Yes.
Okay. What is your name?
Mitchell Bowles,
Can you tell me your date of birth?
January 4th, 1983.
Can you tell me how old you are?
I am 30.
And what do you do for a living?
I'm a banker,
Okay. How long have you been doing that?
about 7 years.
Okay. Do you have any habits, bad habits that you do?
Smoke about 10 cigarettes a day.
Okay. Do you have any complaints today?
No, ma'am.
Okay. Can you tell me what today is?
Today is Tuesday, November 12th, 2013.
Okay. And do you know where you are?
I'm at 654 Dogwood Trail.
Okay. The first thing I'm going to do is start with the head. I'm going to look for any kind of abnormal, look at the skin, any kind of abnormal deformities, lesions, anything like that. I'm going to palpate the scalp. Okay. Going to palpate the temple artery. If you could clench your teeth together for me. Okay. Open your mouth. Okay. Going to palpate the lymph nodes, the peri-auricular, the post-auricular, the occipital, the submandibular, submental, the deep cervical node, and the superficial, and then there is a subclavicular node. They are all non-palpable. Can you raise your eyebrows straight ahead or straight up for me? Thank you. Going to palpate the sinuses, frontal sinuses. Is there any tenderness?
No, ma'am.
Then upper crust. Any tenderness?
No.
Okay. I'm looking at his nose. You'll tilt your head up for me. Making sure that his nares are patent and clear. There's no drainage. Going to look at his ears. Make sure they are symmetrical. Make sure there's no oozing drainage. Also going to test his cranial nerve as well. Mr. Bowles, I'm going to do a taste test, and I'm going to ask you to close your eyes and stick out your tongue, and there's 4 tastes. There's a salty taste, there's a sweet taste, sour taste, and a bitter taste. I need you to identify these. Do you have anything in your mouth?
No.
Okay. Close your eyes for me. And stick out your tongue.
Salty.
Okay. Have you rinsed your mouth? Okay.
Sour.
Okay. Rinse your mouth.
Sugary.
Okay. Rinse your mouth one more time for me. Eyes.
Bitter.
Okay. Now I'm going to touch something. You need to tell me if it's soft or or if it's sharp. This is testing his senses, or his sensory. I'm going to strike above your eyebrow and on your cheek, and you tell me if it's soft or sharp.
Soft. Hard. Soft. Hard.
Okay. You can inspect his mouth. If you will show me your teeth. Okay. Do you have any dentures or
No.
any loose teeth? Okay.
No.
So you got your tongue looking at the side of his mouth. I will use a light. Inspect any kind of, stick your tongue out for me. Okay. I'm going to ask you to repeat 3 words for me with your tongue out. I need you to repeat these words. Light,
Light.
tight,
Tight.
dynamite.
Dynamite.
Okay, and now I'm going to test his gag reflex. Stick your tongue out for me. Head up, tongue out. Okay, it is intact. Okay, now I'm going to palpate his thyroid. Alright, if you will tilt your head out and to the right for me, please. Okay, can you swallow for me? Okay, and straight forward. Feeling his trachea, can you swallow for me? Okay. Kind of tenderness.
No.
I'm going to ask you to put your chin to your chest. Okay. Turn to your right. Okay. Push against my hand. Okay. Turn to your left. Do the same. Okay. Need you to push up against my arms. Very good. Okay. And then I'm going to, if I were to test his vision, do you wear any kind of corrected lenses?
I wear contacts.
Contacts for?
I can't see far away.
Okay. I don't have a Snellen chart. If I did, I would ask him to stand 20 feet away and have him cover one eye, and he would read, as far as he could, read the letters, and the top number would represent what he could see, how far he could see, and the bottom number would represent what a normal person could see. So if it were 20/40, he could see 20 what a person could see at 40. Also, let's see, I'm going to ask you to cover your eye for me. This is called the confrontation test. I'm going to do the same for my eye. And you tell me when you can see my finger. Just say now.
No. No. No.
Okay? Cover your other eye for me.
No. No. No.
Okay. Have you cover your eye again? Okay. Going to check for his pupil, his reaction to light. Okay. Okay. Cover your other eye for me. Okay. If I had an ophthalmoscope, I would have him cover that eye, and I would have it on 0, and I would stand about 25 centimeters away and look for the red reflex and the macula, and look at the optic disc. I would make note on either side, but I do not. I'm also going to, if I had a otoscope, I would inspect his ears. I would hold my otoscope upside down, pull his ear up, and I look inside. I'm looking for his tympanic membrane, which should be white or pearly gray. Looking for any kind of obstructions or foreign bodies, and I do that on both sides. going to do is inspect his chest, his thoracic area. I'm looking for symmetry. Also going to listen to his lungs and listen to his heart. Get back on. Okay, just breathe normal, listening to his heart. Okay, I'm going to listen to the back. Okay, his breath sounds are clear. Now I'm going to palpate and palpate for tactile primitives, and I'm going to ask you to repeat 99 as I do this.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. I'm going to percuss. Again, say 91.
99, 99, 99, 99, 99, 99, 99. 99, 99, 99, 99, 99, 99,
Okay,
99.
that's good. Okay. Any tenderness?
No.
You want to lift your arm for me? Is there any tenderness here?
No.
Okay, on the side.
No.
Okay. Going to go to your back, and I'm going to check for CVA tenderness in his lower back. Or any tenderness?
No.
Right. Now I'm going to inspect his breast. Actually, if he were at home, or if I had him take off his shirt, I would look for symmetry. I would look for any kind of dimpling, any kind of discharge of the nipples, and then I would palpate for any kind of masses or tenderness. And the way I would do that is have put your hands on your hips and push your shoulders forward. I would do that. I would inspect. Also put your hands together, your palms together, and inspect it that way as well. Do you do breast exams at home?
No.
Okay. If this could be for a male or female, I would ask them if they perform self breast exams. And then I would tell the female that she would need to perform this after her cycle, or days 4 to 7 in her cycle. She could perform it when she is about to get in the shower or while she's in the shower. And basically what you're going to do is you're going to stand in front of a mirror. You can put your hands on your hips, and you would look for symmetry, the dimpling, which your nipples would be inside, and you would feel for or look for any kind of discharge. Then you would start on your breast and make circular motions throughout your whole breast, and you would note any kind of lumps or lesions, any tenderness. You do that on both sides, and it's easier to do it in a shower where you have water and soap. It just goes fairly well. You could do the circular motion, or you could go up and down, transverse. And you would do this monthly. Okay? Now I'm going to ask